Hello viewers, I am Dr. N. Murugan. I am practicing as a liver specialist, hepatologist at Apollo Hospital in Chennai. We have created this discussion to highlight the importance of two liver related problems. It is called hepatitis B and hepatitis C. They are both very important conditions that affect the liver. So I hope after seeing these two sessions, you will be enlightened about these diseases and how you can take care of them. Thank you.
Doctor, what is hepatitis B? How does it affect the patients?
As I mentioned earlier, hepatitis B is a blood related infection. Once the hepatitis B enters the body, it will directly go to the liver and cause some problem in the liver. So at the early stage, when it first enters the blood, you get a condition called acute hepatitis B. In this situation, there will be liver inflammation, there will be jaundice, patient may have fever, he will feel weak, he will feel tired. But what is important is, in many patients, it can be completely silent and the patient will not have any symptom. So it is not always necessary that patient will have jaundice or fever. The good thing is, in the acute hepatitis B, the illness or the disease will be present for 10 to 15 days, and in 95% of the cases, the body can completely clear the virus without any treatment. So that is one of the beauty about the hepatitis B, is that the body is able to clear it. Unfortunately, in 5% of patients, the body is unable to clear it. The virus will continue to stay in the body for more than 6 months and then for many years. This condition, where the virus is remaining in the body for more than 6 months, is called chronic hepatitis B. Now, chronic hepatitis B cannot be cleared by the body, and you will need special treatment or attention to clear the virus. If it is not treated over a period of time, and this can vary from 5 years to 20-25 years, slowly the liver can get damaged. You will get first a condition called liver inflammation or hepatitis. That is why the name hepatitis B. And later you get scarring, and this is called fibrosis, and later it will become cirrhosis. So these are all more serious conditions about the liver, and that can lead to complications in the liver at a later stage.
Hepatitis B, how common in India?
India is considered as an intermediate prevalence for hepatitis B according to the WHO classification. Approximately 3 to 4% of population in India suffer from hepatitis B, which is approximately 40 to 50 million people. Worldwide, if you see, 1 million deaths every year occur due to hepatitis B, and maybe 10 to 15% of those deaths may be from India, and Southeast Asian countries are slightly higher than India. So it is a very common and significant problem in India. And what is also worrying is that still new cases are being diagnosed in India, which should come down with the proper practices and vaccination, but it is still not happening in India.
Hepatitis B, how it spread?
Hepatitis B, I mentioned earlier, spreads through blood, but in the case of hepatitis B, it can also spread through body fluid, and semen also it can be spread. So maximum spread occurs by exposure to blood product and blood. Nowadays, for the last 25 years, hepatitis B is being tested in blood transfusion. But sometimes blood products are used which are derived from blood, and sometimes it is not strictly tested. So sometimes, other than blood transfusion, if blood products are being given to people, that can be a source of hepatitis B infection. The other common problem is in contamination by needles. Again, at least for the last 10 or 15 years, the usage of needles is being very strictly regulated in India, and only disposable needle and syringes are allowed to be used in all hospitals, including government hospitals and health centers. But what we find in real life is that still in many places there is reusage and not adequate cleaning and sterilization of needles and syringes. So this way, if these kind of needles and syringes are used, the virus can be spread. The other problem is instruments used for medical practice other than needles, which can also be contaminated by blood and body fluid. So usually if you go for an operation, all the instruments will be sterilized, but there are some daycare procedures, dental procedures, endoscopy procedures, etc., where some of the equipment that are used may not be sterilized, but they are simply cleaned in a correct way. If this cleaning is not done properly, sometimes these kind of infections can spread. So these are all ways to spread infection in the healthcare or hospital setup. In the public arena also, you can get exposure to needle. For example, many people are using tattoos nowadays. They are doing body piercing, ear piercing and other parts of the bodies. This can also, if you don't go to a proper hygienic place and the needle and the equipment used is not sterilized correctly, this way also hepatitis B and other infections can spread. So as a public, you should be very careful in these type of situations. The other problem in hepatitis B is sexual transmission. So if a person with hepatitis B can transmit through sexual transmission to the partner. So this is something that is well recognized. It may not happen in all cases, maybe in 5 to 10% of cases it may happen. So there is something to remember, and accordingly you should take precaution and get tested if there is a risk. One more way it can spread is by mother to child, especially if the mother has very high virus at the time of delivery, it can spread to the child. There are few misconceptions in this situation which I want to clarify. The spread of the virus is only at the time of the delivery, not during the pregnancy, which means in the womb itself it is not going to spread to the child. Only at the time of delivery it will spread. It will not spread from the father to the child, only from the mother to the child. If the mother is given treatment during the pregnancy to reduce the virus and the baby is given antiglobulin and vaccination at the time of birth, the spread of virus can be reduced to less than 1%. So if you are having a hepatitis B patient who is a lady, you can definitely have childbirth without any fear, provided adequate precaution is taken. You should consult a proper specialist and take advice during the pregnancy. It is also advised that all women who become pregnant should be tested for hepatitis B and for hepatitis C. This is recommended by all the associations, but in practice it is still not happening. So you as a public can remember and make sure that any of your relatives, friends get pregnant, they should be tested, and if they are found positive, adequate precaution should be taken in consultation with a specialist. So other area is, if you are living with somebody with hepatitis B in the same house, it can spread, and here there is a lot of fear among the patient, how much they can be with this patient, can they touch them, all these fears are there. Mainly if you share things like razors, toothbrush, these are the kind of things that can spread the virus. But if you're sitting with them, you're eating with them, or you're touching them, or kissing them, or hugging them, holding the hand, by food or water, it will not spread. Again, in pregnancy, I forgot to mention, breastfeeding, many times the women ask, can I do breastfeeding because I have hepatitis B? It is considered safe. The risk of transmission is almost zero. Maybe very rarely it can occur if there is a bite or a blood transfer. But predominantly we don't worry, and we allow women to breastfeed without any problem.
Overall risk for develop hepatitis B
is a little bit related to the previous question. So people who have exposed to blood contamination will be at risk for developing hepatitis B. So anybody who goes to healthcare facility, hospital, if they are exposed to needle which is contaminated, then this is a risk. So as a public person, you cannot make sure, but you have to be clear that the facility you go is following the strict principles of sterilization and hygiene, and make sure any syringe or needle that is used is fresh and not reused. That is one thing. I mentioned sexual contact, it can spread. So if you have an unknown partner who is a sexual partner, then it is your risk. Otherwise, if it is somebody with already hepatitis B, then you should get vaccinated so that you will not get hepatitis B. So that is another risk. IV drug use is a problem in some parts of the world and in some parts of our country also, where people inject themselves with IV drugs for getting high or getting for a recreational use, and many times they will share needles, and this is a dangerous practice not only for their health of using the drugs but also for the development of infections. And it is well known for the from our point of view, from the doctor's point of view, that IV drug users have a very high incidence of hepatitis B, hepatitis C and HIV compared to the normal population because of such practices. So these are people at risk. If you are living with a person with hepatitis B, we talked about this in the previous question, then if you don't take precaution and you are careless with the contact precaution, you may develop. So we are advising all patients living with a person with hepatitis B to take precautions and maybe even get vaccination. In patients who go to hospitals frequently, particularly patients who are going for hemodialysis, they are at risk for hepatitis B. Now almost all hemodialysis facilities take precautions so that it does not spread between patient to patient, and they are testing regularly and taking adequate precautions. So the incidence of patient getting hepatitis B from hemodialysis is coming down. So this is something for dialysis patients to keep in mind, and you should inquire and make sure that wherever you are getting dialysis is following all the correct practices that they are supposed to follow. And mother to child I already discussed, it can spread, but if you take adequate precautions, that can be prevented to less than 1%.
So what are the symptoms of hepatitis B?
Earlier I mentioned that hepatitis B can come as acute hepatitis B when it first enters the body, and at that time patient can have like a jaundice attack. You will have fever, you can have weakness, tiredness, vomiting, and followed by jaundice. So this will last anything from 15 days to 30 days, and majority 95% will clear the virus and the jaundice will settle down. There are some medications we use to help the patient to reduce the symptom and clear the jaundice in a faster way, and that can be given. In the chronic hepatitis B, when the virus is staying in the body for more than 6 months, the symptoms in the early stages may not be obvious to the patient. This is the danger period because the patient is having the virus, they may be having liver inflammation and scarring, but they don't feel unwell and they don't have any symptoms. If at all they feel symptom, it may be very general symptoms like fatigue, tiredness, weakness, maybe a little bit of weight loss, reduced appetite, and many times patients think they are overworked or some other stress, and they don't take it as a serious illness, and they don't think that it could be something like hepatitis B. So these are early symptoms where the patient don't feel much. In the later stages where the liver gets damaged and cirrhosis and serious conditions occur, then patients may become very sick. One of the dangers of hepatitis B is in the chronic hepatitis B, when the reactive phase is continuing, they develop complete damage of the liver called liver cirrhosis. This is a serious condition and it can lead to death. This usually occurs anything from 10 to 30 years after developing hepatitis B. It will not happen to all the patients, it will only happen to a few patients, maybe 10 to 15% of all the patients. And in these patients who have the reactive phase carrying on for a long time. But once cirrhosis develops, it is very difficult to treat the patient and it cannot be reversed completely. Slowly the patient's liver function will deteriorate, they will develop liver failure. In this time, the patients can become very sick. Many times they develop fluid all over the body, they can become drowsy and go into coma, they can have blood vomiting, they can have frequent infection. The body becomes very thin, they lose all the muscle, and this is a serious condition. Like I mentioned, it can lead to death. The other serious complication about after developing cirrhosis is liver cancer. This also invariably leads to death of the patient. Nowadays, when patients present with these serious complications, we control the virus and we recommend the patients to undergo liver transplantation, because without that there is no cure for the patient.
Doctor, how many types of hepatitis B and how can be diagnosed?
So hepatitis B can exist in different stages. they already I mentioned recently that it comes in many stages. So in the carrier stage, which is the stage where there is no activity of the virus and the liver is all right, the patients will be fine. They won't have any symptom and they don't have much damage in the liver. Even if we take the liver to test it using a liver biopsy, they are fine. The next stage is the immune reactive stage, where liver enzymes, SGOT, SGPT, everything will be high. They may have jaundice and they may have some scarring called fibrosis. One way to test this is to do liver biopsy, but liver biopsy is painful, it needs hospitalization, it is costly, there are some complications. So nowadays we are using non-invasive testing of fibrosis, and one of the techniques we are using in my hospital is called FibroScan. This is a new test where we use a scan to determine the level of the scarring and damage in the liver. This is an excellent way to find out how the hepatitis B has affected the liver without doing a liver biopsy or anything very dangerous. And it is a simple test and it can be done many times without any difficulty. So this will tell the doctor, treating doctor, exactly what is the level of damage in the liver, and accordingly the treatment can be tailored to the patient. So this is a very useful addition to the diagnosis of hepatitis B. The third stage is the stage of fibrosis and cirrhosis, which I talked about. And again, cirrhosis can be diagnosed by many techniques. Sometimes a simple ultrasound will tell they have cirrhosis. Sometimes you do CT scan of the liver for other causes, it may show cirrhosis. And if specifically you want to check, then FibroScan, which is another type of scan which is specifically for the liver, can tell exactly whether the patient has cirrhosis or not. And again, depending on the findings, we can plan the treatment. So to diagnose hepatitis B, we look at two aspects. One is to see what is the status of the liver and how much it is damaged. This can be done through blood tests and all the scans that I have mentioned. Second most important is to diagnose the virus. So first you have to know if the patient has hepatitis B. So for that there is a test called HPS-AG, which is a simple test. It is done through a blood test and it will tell whether the patient has hepatitis B or not. There are some rapid tests available which we use for screening, where the result will be ready within half an hour to 1 hour. It is reasonably accurate, around 90% accurate, but it is more like a screening test. So sometime in health camps or in schools or colleges where they do health camps, or maybe at your place of work, they will do a screening test and tell you have hepatitis B. It is worth checking in a proper lab with the HPS-AG to make sure that this is confirmed. And once HPS-AG is confirmed as positive, that means the person has hepatitis B. So this is the confirmation test. So once the hepatitis B has been diagnosed, you need further studies of the virus activity to see what is the level of activity in that patient. So for that, two blood tests are done. It is called HBe antigen test and a very, very important test called HBV DNA test. So every person with hepatitis B must do the HBV DNA test. It is very, very important to do it at least once to know the status of the virus in your blood. Just doing it once may not be enough because this level can keep changing. So we recommend that at least once a year patient should have a DNA test to study the virus, and this is very, very important to protect you from developing serious damage to your liver. Because if the DNA starts to increase, it will damage your liver. And there are very good medicine to control the DNA, and this can save the life of the patient. So it's very, very important that all hepatitis B patients should do DNA at least once a year. But please follow the advice of the doctor who is treating so that they can guide you according to each patient's condition. So these are some of the tests we do to confirm hepatitis B, to see the activity, to study the liver, and then plan the treatment for each patient.
Dr. Hepatitis B, can it be cured, sir? And what are the type of treatments available for hepatitis B?
This question, obviously everybody with hepatitis B comes and asks this question to the doctor, can I be cured? I want to clear the virus. So it is in a way difficult question to answer because the hepatitis B cannot be completely removed from the body once the patient develops chronic hepatitis B. You remember I told you earlier that in the acute hepatitis B, when the virus first enters the body, 95% of patients will clear the virus, and that can be considered like a cure. What we believe is that even in the acute stage, there is some virus particle that stays behind in the liver, but generally in the patient's lifetime, it will not cause any disturbance and it will remain quiet. Only in very rare circumstances, it can get reactivated and again cause virus activation in the patient. But by and large, once the HBsAg leaves the body and the virus leaves the body, we can consider that patient to be cured. But in chronic hepatitis B, this will not happen. It is estimated that by chance the body can clear the virus in roughly 5% of patients, but majority, 95%, it will not be cleared. But having said that, we can control the virus down to a level which is very, very low, so that the liver will not get damaged. And this is the most important message as far as treatment is concerned. Because when the DNA is high, that means the virus is reactive. When the DNA is low, that means the virus is quiet and it is in carrier stage. So the DNA is an important test to know the activity of the virus and how to give the treatment. So that's why I mentioned earlier that DNA has to be checked and repeatedly checked every 1 year. If the DNA levels are high, and usually we use a level of 2000 to determine whether it is high or low, and in some patients 20,000. So this is the level you should remember, 2000 and 20,000. So if it is higher than this level, and depending on each patient we decide which level to take, then that patient may require treatment to protect the liver. And now we have very good medicines by tablets which can reduce the level of the virus from the DNA level from whatever level it is. Sometimes we see even crores. I have seen up to 100, 150 crores also I have seen, and it can be reduced down to zero within a few months, and the patient can be completely improved from his liver condition. So when we say cure, we mean the virus has to leave the body. That may not be possible in all the patients, but definitely we have very good medicines to reduce the virus, improve the patient's condition, protect the liver, and even if the patient has developed liver failure or liver cirrhosis, to a large extent they can be reversed and brought down, the level can be brought down, and even patients who are very, very sick can return to completely normal lifestyle with good medication. So there is excellent treatment available for hepatitis B at any stage. So it is important for each patient to find out what stage they are, what is the treatment that will be best for them, and take help accordingly.
Doctor,